And so I'd like to begin by saying good morning or good afternoon, depending on where you're from. My name is David Davis, and I serve as the project director of the National Center of Excellence for Tobacco-Free Recovery. I'd like to thank you so much for being with us today for today's virtual session, supporting your loved ones with mental health, illness, or substance use disorders in addressing tobacco use and the role of families and that family peers play. Today's session is going to be informative, it's going to be interactive, and applicable to your work and the reality in supporting individuals you serve and your loved ones in addressing their tobacco use. So thank you so much for joining us today, and we're going to dive right in. So I want to take a moment to just acknowledge our funders here. This opportunity is made possible by the Substance Abuse and Mental Health Service Administration, SAMHSA, which has awarded CAI funding to administer the National Center of Excellence for Tobacco-Free Recovery, also known as the COETFR. And just a little bit about CAI. We're a diverse, mission-driven nonprofit incorporated in 1979, and we work nationally and internationally, and our mission is to use the transformative power of education and research to foster a more aware, healthy, compassionate, and equitable world. And we do this by providing innovative and high quality training, technical assistance, curriculum development, research, and other capacity building support to make policy, systems, and people change to addressing the most enduring disparities in health and life outcomes, particularly for communities that have been marginalized. And this includes over 3 decades of experience addressing tobacco control policy, systems, and social norm change. And the goal of our Center of Excellence is to reduce commercial tobacco use among people with mental health and substance use disorders. And to meet this goal, we partner with states and territories, local governments, tribal communities, behavioral health organizations, and the broader behavioral health workforce, including clinicians and peers. And we do this through trainings and webinars, proactive and on-demand technical assistance, practical resources on our project website, and our tobacco-free learning community and leadership academies, which help state teams develop statewide action plans to promote tobacco-free recovery and increase access to tobacco use treatment. So let's go over the objectives for today's session. So by the end of the session, you'll be able to first explain the rates of tobacco use and how it impacts people with behavioral health conditions at every stage of life. Next, we'll identify treatment options and resources to support loved ones of all ages, including youth who vape. And finally, we'll be able to apply practical peer support and engagement strategies to help individuals and families move toward tobacco-free recovery. And to meet our objectives, we'll start by looking at how we got here and the powerful influence of big tobacco and how its legacy continues to impact our communities. Next, we'll explore the rates of tobacco use and its impact across the lifespan, understanding how it affects individuals and families at every stage of life. Then we'll reimagine together the way forward, focusing on what families and family peer specialists need to know to support the tobacco quit journey. We'll talk about what family peer specialists can do to address tobacco use in their everyday work. And after that, we'll move into Q&A and close by sharing how the COETFR can support you in this important work. So before we dive in, let's take a moment to get to know who's in the virtual room today. We'll start with a quick poll. Who's joined the webinar today? And let me launch this poll here. 1 second. All right, so the poll should be coming up. If you could take a moment just to answer the polls, and let's see who's in the room with us today. All right, folks are coming, answers are coming in. I'll give it a few more. We'll have 1 or 2 individuals. Give it 1 or 2 more seconds here. All right. So, seems as if we have a lot of family peer support specialists and family members of someone dealing with mental health or substance use disorder challenge. So it seems like we have about one administrator here. And so thank you so much for joining us and letting us know who's in the room. All right, excited to have this conversation with you. All right. Now, we have a second poll for you all to participate in, right? How has tobacco use impacted your life? And so I'm going to launch that poll right now. All right. And that second poll should be up here. Great, folks are dialing in on this. We'll give it a few more seconds for everyone to share. All right, one or two more seconds here. All right, we'll end this poll and I'll share the results with you all. All right, and we see here a large proportion of folks says, hey, I have a family member or a friend whose health has been negatively impacted by the use of tobacco products. A few folks here saying, I currently use tobacco products. I used tobacco products in the past, but have quit. I've lost a loved one due to a tobacco-related illness, and a few folks said, "Hey, tobacco has not significantly impacted my life." All right. So thank you all for sharing. And as you can see from the poll results, tobacco use seems to, for many of us, has touched our lives in personal and powerful ways. But now let's talk about how did we get here? How did tobacco become so deeply woven into our communities, especially within mental health and recovery spaces, despite everything we know about its harm? So to answer that, let's take a look back at the historical forces that have shaped this landscape. So the history of big tobacco shows a troubling pattern of targeting people with mental health and substance use conditions. Starting in the mid 20th century, companies marketed cigarettes as a way to relax and release stress, appealing to those experiencing distress. Ads often feature doctors and celebrities promoting smoking as shown in this 1930s ads. And in the 1970s and 1980s, tobacco companies intensified marketing in hospitals and treatment centers, offering discounts and sponsoring events to reach people with mental health and substance use challenges. Over time, smoking became a part of a daily life in behavioral health settings, used as a reward for progress and a way for staff to connect with clients. Even today, smoking is often seen as a coping tool and social activity, showing how big tobacco's targeting created lasting norms that make quitting harder for many individuals in recovery. And so, despite overall decline in national smoking rates among adults, we're still seeing big tobacco's impact in our lives as smoking rates are significantly higher for those of us dealing with serious mental illness and substance use disorder. The smoking rates for people with schizophrenia is 85%. It is 70% for people dealing with bipolar disorder, 24% for people with major depressive disorder, and between 65 to 85% among people in treatment for substance use disorder. And looking at the data from the 2023 SAMHSA National Survey on Drug Use and Health, this chart compares people with and without behavioral conditions. About 28% of those with these conditions smoke cigarettes compared to 14% without. When including all forms of tobacco use, like vaping, the gap widens to about 44% versus 22%, which is nearly double. And individuals with mental illness or substance use disorders consume almost 40% of all cigarettes smoked by adults in the United States. That means while they represent a smaller share of the population, they carry a disproportionate burden of tobacco-related harm. Additionally, individuals with serious behavioral conditions die about 15 years earlier than individuals without serious mental illness who never smoke. And tobacco use causes more deaths among individuals receiving substance use treatment than alcohol or other substance use. Excuse me. So these numbers tell a powerful story, but the impact of tobacco use doesn't stop at diagnosis. It extends across the lifespan, affecting physical health, emotional well-being, and families and systems. The impact can begin before birth. Smoking during pregnancy can harm the baby, leading to low birth weight, poor lung growth, and high risk of heart and lung problems later in life. Children exposed to secondhand smoke also face greater risk of asthma, ear infections, bronchitis, pneumonia, SIDS, and delayed development. During adolescence, tobacco use often begins and can lead to lifelong addiction. Nicotine disrupts brain development related to attention, learning and memory, and increases risk for anxiety, depression, and other mental health challenges. For young adults, the health effects of smoking become more serious. It accelerates plaque buildup in the arteries, slows lung development, and can worsen stress and mental health during this stage of life. And as youth and young adults move through this stage of life, many are also facing new challenges with e-cigarettes and vaping. In 2024, about 5.9% of US middle and high school students, which is roughly 1.63 million youth, reported currently using e-cigarettes. This makes e-cigarettes the most commonly used tobacco product among youth today. Most e-cigarettes contain nicotine, which is highly addictive and can cause lasting harm to the developing adolescent brain. It can affect attention, learning, mood, and impulse control, all areas that are still developing during these crucial years. Among youth who vape, nearly 88% use flavored products, and more than one in four vape every day. Flavors, social pressures, and aggressive marketing all drive high rates of youth vaping and make quitting harder. And as youth become adults, the consequences of tobacco use grow more severe. What often begins as experimentation or a coping tool in adolescence or in other stages can lead to long-term addiction and serious health impacts. Adults who smoke lose about 10 years of life compared to non-smokers. Smoking increases the risk of chronic disease such as heart disease, stroke, lung disease, and cancer. And tobacco use also reduces quality of life, causing fatigue, breathing problems, and financial strain for individuals and families. Right? So tobacco use has lifelong consequences affecting both physical and mental health from before birth through adulthood. It increases the risk of chronic disease, reduces quality of life, and often shortens lifespan by many years. Because tobacco use touches every stage of life, families play a vital role in helping loved ones heal and recover. Family peer specialists are uniquely positioned to support these conversations, offer hope, and guide families in addressing tobacco use as part of the overall recovery journey. So let's now discuss the role of a family peer specialist. So as family peer specialists, use your lived experience as a parent or caregiver of someone dealing with a mental health or substance use challenge to guide and support other families. You help them navigate systems, advocate for their loved ones' well-being, and connect to resources across the lifespan, even as children grow into adulthood and identify their own supports. And you already have the skills to help families address tobacco use and vaping. The same strengths you use to support recovery also guide families in these conversations. You promote resiliency, recovery, and wellness by inspiring hope and showing that change is possible. Exploring tobacco use is part of that same recovery journey. You are skilled in effecting change by meeting people where they are, encouraging small steps, and supporting readiness for change. You connect families to resources and natural supports like quit lines, counseling, and community connections that strengthen recovery. And you use your systems knowledge to help families access tobacco treatment, understand coverage, and advocate within care systems. And through your professional responsibility, you bring empathy, respect, and compassion to every interaction, creating safe spaces for open conversation. So, as family peer specialists, you are fully equipped to support families in addressing tobacco use with care and confidence. So, you've seen how your skills and lived experience already align with supporting families around tobacco use. Now, let's take the next step and think about what families and family peer specialists need to know to truly support someone on their tobacco quit journey. So, let's start off by grounding ourselves in identifying both myths and facts related to addressing tobacco use for people dealing with mental illness and substance use challenges. I will read a statement, and when it appears on your screen, please choose either myth or fact in the poll option. All right, let me see here. I'll launch the poll. All right, so the first poll is individuals with behavioral conditions are not interested in addressing their tobacco use. All right, folks are coming in. Votes are coming in. All right, we'll give it another second or so. All right. So many of you all said that that was a myth, that individuals with behavioral health conditions are not interested in addressing their tobacco use, right? And so if you chose that option, then you got the correct answer. This is a myth. The vast majority of individuals with behavioral conditions desire to quit or reduce smoking or vaping, right? And people living with mental illness want to quit and are better supported in their quit journey with access to treatment. It is important to understand that smoking behaviors in substance use disorder treatment, especially for patients receiving methadone maintenance, right? Um, they express, interest in quitting. 65 to 75% have tried before, and a large majority, 75%, would join a cessation program if available. All right. And most youth want to vape or want to quit, and nearly two-thirds have tried to stop in the year. So what you're seeing here is that, yes, for sure, individuals dealing with mental health and substance use challenges indeed want to address their tobacco use. All right, let's move on to the next poll. And I'm going to launch it here. For some reason, this poll seems to be, let me see if I can stop sharing. Ah, there it is. I'm so sorry. My apologies. I was still sharing that poll from last time. All right, so poll number 4 is now shared. Smoking or vaping worsens symptoms of mental health conditions. Is this a myth or is that a fact? Folks are chiming in. Votes are coming in. All right, we'll give that 1 or 2 more seconds for folks to respond. All right, so the majority of folks said, hey, this is a fact that smoking or vaping worsens symptoms of mental health conditions. And only about 2 folks said that this was a myth. And this is indeed a fact. A common myth is that smoking alleviates mental health symptoms. And it's so important to note that during the quit journey, it's important for us to understand smoking makes mental health symptoms worse. When someone stops smoking, they'll start to experience withdrawal symptoms from tobacco use, which can mimic or intensify mental health symptoms. This creates a vicious cycle where individuals believe smoking is helping them cope, when in fact it's contributing significantly to their discomfort. Also, treating tobacco use is associated with improvements in one's mental health and can reduce substance use disorder relapse. All right, and let's go to our final poll question for today. People with behavioral health conditions can't quit smoking or vaping. And I'm going to launch that poll for you now. And polls should be coming up on your screens here. All right, I'll give it 1 or 2 more seconds. Okay, great. And so the majority of folks said that this was a myth, right? That people with behavioral health conditions can quit and they can quit with the right support and treatment. So you all were, many of you were on the money here for related to this myth versus facts question. All right. So let's pull this all together to understand what the quit journey is for tobacco use. Excuse me. First, tobacco use is an addiction, not a habit and not a choice. Next, it is essential to remember that most people living with mental health conditions want to quit or reduce their tobacco use. They may not always say it out loud, but the desire is there. However, quitting is not easy. Research shows it can take 30 or more quit attempts before achieving lasting success. That means relapse is not a sign of failure, it is part of the process. When someone tries to quit and does not succeed, it can feel deeply personal. They may begin to believe they have failed or that they will never be able to quit. That is where stigma takes hold and can make recovery even harder. That is why it's important that we view quitting as a journey, not a single event. Each attempt matters. Every try builds new skills, confidence, and resilience, all of which bring a person closer to long-term recovery. Our role as family, friends, and supporters is to walk beside them with compassion and patience. We can help normalize relapse, celebrate progress, and remind our loved ones that the journey is worth it and that none of us are alone in it. So, we're going to talk a little bit more about how to support individuals on their quit journey using evidence-based interventions. So the first evidence-based intervention we like to talk about here is called the stages of change model, which many of you are probably familiar with. It's also known as a trans-theoretical model of change. This model was developed by psychologists James Prochaska and Carlo Di Clemente, and I hope I pronounced the names correctly. I always get that messed up. It explains how people move through the process of changing a behavior like quitting tobacco. Change happens gradually in stages, not all at once. As family peer specialists, understanding these changes helps us meet people where they are and support them in ways that match their readiness to change. So let's walk through each stage. The first stage is pre-contemplation, and the stage of treatment is engagement. At this point, the person is not yet thinking about quitting. They may not see tobacco as a problem or may not want to discuss change. Our goal here is to build trust and connection. We focus on listening without judgment, showing care and curiosity, and offering small practical supports. We can gently share information about nicotine replacement therapy or other tools to support comfort in tobacco-free environments and recovery goals. The next stage of change is contemplation, and that stage of treatment is where we're going to provide the treatment of motivational building. In this stage, the person is starting to think about quitting, but still feels unsure or conflicted. Our role is to help build motivation through open and respectful conversation. We can ask what they like about tobacco, what worries them about quitting, and what benefits they might gain. We can also continue to share information about counseling, quit lines, or NRT. The goal is to help them see that change is possible and support their growing confidence. The third stage of change is preparation, and the stage of treatment is also motivation building. Here, the person is getting ready to quit. They may have set a quit date or started to cut down. This is the time to help them plan. We can talk them through triggers, discuss coping strategies, and connect them to counseling or a quit line, such as 1-800-QUIT NOW, and we can encourage them to use NRT or medications to make quitting easier and more comfortable. That fourth stage of change is action, and the stage of treatment is being active. At this stage, the person is actively trying to quit. Our role is to provide steady encouragement and positive reinforcement. We help them manage cravings, remind them to use their medications correctly, and celebrate their progress. Even small wins matter. This is also a good time to remind them that they're not alone and that support is available whenever they need it. The final stage of change is maintenance, and that stage of treatment is relapse prevention, and the stage of treatment is relapse prevention and response. In this stage, the person has quit and is learning to stay tobacco free. We can help them plan ahead for triggers or stressors that might cause cravings. If relapse happens, we remind them that it's not a failure, it is part of the learning process. Our role is to help them get back on track, reflect on what they learned, and keep moving forward with confidence. So the stage of change model really reminds us that quitting tobacco is a process, not a one-time event. People move back and forth between stages, and that is completely normal. Our job is to stay supportive, compassionate, and patient, offering encouragement, sharing resources, and helping people connect with professional counseling and medications. And that way we can give them the best chance of success on their quit journey. All right, now let's talk about some medications for treating tobacco use. We have nicotine replacement therapy, also known as NRT, which is approved by the FDA to treat tobacco use and available over the counter. And it should be considered an essential tool in supporting loved ones who are trying to quit tobacco. As family care specialists, you're not prescribing treatments, but you play a vital role in raising awareness and helping families feel more confident discussing and exploring options. NRT helps reduce nicotine cravings without the harmful chemicals found in cigarettes. This can be especially helpful for individuals with mental health or substance use conditions where nicotine withdrawal may worsen anxiety, mood swings, or focus. When someone tries to quit cold turkey, they often struggle with withdrawal symptoms, and NRT offers a safer alternative, easing that transition and helping loved ones feel more in control of their quit journey. So the key message here is quitting smoking is hard, but with the right tools, it's possible. And there are four main types of NRT that are currently available on the market. We have the patch, the gum, the lozenge, and the spray. Nicotine gum provides quick relief from cravings. Nicotine patch delivers a steady dose of nicotine throughout the day. Nicotine lozenge, they dissolve in the mouth and helps manage sudden urges. Nicotine nasal spray is fast acting and used for more intense cravings. The patch, gum, and lozenge can be purchased over the counter, while the spray requires a prescription from a healthcare provider. For best treatment outcomes, it's important to combine NRT with counseling. For example, using the patch together with a gum or lozenge or spray along with behavioral health support. This combination approach significantly increases the chances of successfully addressing someone's tobacco use. And it's crucial to use nicotine replacement therapy consistently and exactly as prescribed to get the full benefit. Skipping doses or using NRT intermittently can reduce its effectiveness in managing withdrawal symptoms and cravings, making it harder to quit. Using recommended dosage, always use the recommended dosage of NRT to ensure you're getting enough nicotine to curb cravings and prevent relapse. Using too little can leave you vulnerable to cravings, while using more than recommended could lead to unpleasant side effects. In terms of the patch, when applying the nicotine patch, make sure to place it on a clean, dry, and hairless skin to ensure proper absorption of nicotine. It's important to apply the patch to a different area of your body each day to avoid skin irritation. Don't wear the patch for longer than recommended and make sure to remove it before going to bed. In terms of using nicotine gum and lozenges correctly, you're going to be using that chew in part method or that suck in part method. Nicotine should be chewed slowly. Nicotine gum should be chewed slowly in part between your cheeks and gum when you feel, and of course, you're going to be feeling a tingling or sensation or taste. And this really allows nicotine to be absorbed gradually without overwhelming your system. Similarly, for nicotine lozenges, you should be sucked slowly, not chewed, and let the lozenge dissolve completely in between those cheeks and to ensure proper absorption of the nicotine. Both methods can help manage cravings effectively while preventing excess nicotine intake that can cause side effects. And let's talk now about treatment considerations and support for youth in their quit journey. As a family peer specialist, you may support caregivers who are concerned about a teen using tobacco or vaping products. So it's important to remember that your role is not to provide clinical treatment, but to offer understanding, encouragement, and connection to care. Here are key treatment considerations based on guidance from the American Academy of Family Physicians and the American Academy of Pediatrics. So you want to start with supportive youth-centered counseling. Encourage caregivers to approach the conversation with empathy and without judgment. The goal is to meet the young person where they are emotionally, socially, and behaviorally. Building trust takes time, and this is not about fixing the youth, it's about understanding and support. We want to use multiple ways to connect. You want to let families know that counseling and support can happen in different ways, in person, by phone, online, or through printed resources. Helping youth access support in a way that feels safe and comfortable for them can make a big difference. And for youth who show stronger nicotine dependence, such as daily use, withdrawal symptoms, or who want to quit but are struggling, nicotine replacement therapy or NRT may be helpful. While NRT products like patches or gums are not formally approved by the FDA for people under 18, they can be prescribed and used off-label under medical supervision. Encourage families to talk with a doctor, nurse practitioner, or other healthcare provider who can determine if NRT is appropriate and provide guidance on how to use it safely and effectively. All right. And encourage parents and caregivers to be active, empathetic, supporters, not enforcers, right? Peer mentors can play a powerful role. Young people often listen more to peers and adults. Acknowledge and respect the teen's autonomy and stage of readiness. We're here to support, not pressure. Use positive reinforcement, highlight strengths, celebrate wins, and encourage progress over perfection. And we also want to provide honest, age-appropriate education, both in schools and through community settings. Avoid scare tactics. Instead, focus on health, safety, and informed decision-making. Empower youth with knowledge so they can make their own choices, grounded in respect and care. And equip families and peer supporters with tools to guide conversations, not control them. Your role is to encourage, educate, and empower. Help families understand that quitting is a process. Encourage them to keep the lines of communication open with their young individual, and let them know that compassion, consistency, and connection can go a long way in supporting a young person's health. All right, so now I want to just take the opportunity to share some resources for youth that can support them in their tobacco quit journey. All right, so as you can see here, we have some resources from the National Cancer Institute. There's 1-800 Quit Now programs. We have text programs from the National Cancer Institute as well. There's programs connected to the Truth Initiative. This is quitting program. And the Lung Association has a program called Not For Me. And this is the American Lung Association program is a mobile-friendly program designed to help youth age 14 to 19 stop using e-cigarettes. And here's some resources for parents and caregivers supporting their child's tobacco quit journey. So we have here PAVE, Parents Against Vaping and E-Cigarettes. This is a national advocacy and education organization founded by parents. PAVE offers tools, webinars, and policy updates to help families take action against youth vaping. We also have the HHS Hub for Parents. This is a vaping prevention and quit resources hub that the U.S. Department of Health and Human Resources provides. And really, what it does is provide evidence-based tips, facts, and conversation starters to support parents and educators in preventing and addressing youth vaping. The Truth Initiative also has a vaping prevention and quit resource, which is really top tips for parents and educators. And this resource from the Truth Initiative offers practical advice, conversation guides, and quit support tools to help parents and educators prevent youth to vaping and support teens ready to quit. All right, so let's dive now into what you can do as a family peer specialist to address tobacco use. All right, so pulling this all together, you already have the core skills and competencies to do this work. Skills like engagement, education, advocacy, and cultural humility. You can use these strengths along with information shared in this session to guide your conversations with families, right? You want to start with love and grace and meet each person where they are. Listen first, honor their story, and offer support without judgment. We want to normalize tobacco use in vape screenings and discussions by explaining that these questions are asked of everyone to support whole person health. We want to use love and grace to introduce and help families access nicotine replacement therapy or NRT. Explain how it works, where to get it, and how we can support progress even before someone is ready to quit completely. You want to connect NRT to recovery goals by showing how reducing or quitting tobacco and vaping can improve mood, energy, and overall well-being. And you want to model honesty and empathy. If you use tobacco or vape yourself, your openness can create powerful connection and understanding. Finally, you want to link to families to ongoing resources like the Quit Lines, counseling, and peer support, reinforcing that recovery is a shared and supported journey. So, I'd like for us to take a look, and my apologies here. I'm going to be taking a look in the chat shortly. Want to ask you all, how would you begin this conversation with individuals you serve? If you're going to start to begin to talk to someone about their tobacco use or about really doing this in a non-judgmental way, how would you do that? I'd ask you for you all to just drop some notes in the chat, right? So think about an individual or family who might have many competing priorities or challenges. What words or approach would you use to bring up tobacco use in a caring and non-judgmental way? Please feel free to drop those responses in the chat. All right, I see Bradley has noted non-judgmental approach, voicing reasonable concern for health, but not preaching and demeaning them. Love that response, Bradley. Amy says relatability. to how hard it is to quit, maybe offering to be a support or quit with them. Excuse me. Thank you so much for noting that, Amy. Great response. Jackie says, I would ask if they're interested in information on quitting smoking first. Thank you so much for noting that, Jackie. Any other thoughts about how you would begin a conversation with the individuals you serve around addressing tobacco use? We'll take one or two more. Anna says, ask about the challenges with smoke use and offer support that person would like to receive. Scarley says, listening, what is substance use doing for them and how can their needs get met in other ways? An individual from Nevada says, letting them know that you are here to support. Thank you all for sharing those great ideas, right? And there's no single right way to start these conversations, right? What matters most is showing care, respect, and genuine curiosity about the person's experience. And I saw with a lot of the responses, folks are starting from that place. You're not trying to talk down the folks, you're not trying to demean them. You're really talking about coming from a place of love and grace and support. So let's look at a few examples of how you might begin the conversation. So, to start, here's some tips for beginning the conversation. And many of you all already have some of this down packed, right? So you all share that in the comments. So here's some of our general tips. We know it can be tough to have these conversations, especially when the individuals you serve are dealing with so many other priorities or challenges in their lives. Talking about tobacco use might not feel urgent to them, and that's okay. Our goal is to bring it up with care, understanding, and respect for where they are right now. So here's a conversation starter. When talking about tobacco use, it helps to keep your tone caring and supportive. You might start by saying, we ask about tobacco use because we care about your whole health. There's no judgment. I'm here to support you. I heard a lot of people echoing that within the comments that were shared. Or you might say tobacco use is common, especially when people are dealing with stress or other challenges. If it's part of your story, we can talk about it whenever you're ready. And to keep the door open for future conversations, you could say, this isn't a one-time question. We can check in about this whenever you want because even small steps can make a difference. Or whether you're thinking about quitting, cutting back, or just learning more, I'll meet you where you are. The goal is to make each conversation feel open, judgment-free, and to focus on support, not pressure or expectation. All right. Now let's talk about what this looks like if you're a family peer specialist who uses tobacco yourself, right? And I did know if someone says we can quit together. I love that, right? You share that you'll be honest about that and saying, hey, I understand that struggle and I can actually do this journey with you. If you're currently smoking or vaping, you can still be a powerful source of support. Your honesty, your empathy may actually help families feel more understood. You don't have to be tobacco free to guide someone. You just need to walk alongside them with love and grace and shared humanity. So, sharing experiences shows empathy and builds connection. So, for example, you might say, I know it's hard. It can be. I've struggled with it myself. We can figure this out together. And I can share what's helped me or what I've learned along the way. We can figure this out together. There are great tools out there, and I can share what I've learned along the way. I'm working on this too, and it helps to have support. We can both take it one step at a time. Right? So these are really great ways because to be honest about the fact that you're on your own journey could mean the world to someone who wants to really understand that experience and feel connected that they have someone who understands their personal experience. All right. So here's some key takeaways that I'd like you all to walk away with from today's discussion. First, people with behavioral health conditions want to quit and can with the right support. Second, tobacco use worsens mental and physical health and shortens lifespan. Family peer specialists, you all play a vital role in guiding, supporting, connecting families to care, and promoting NRT. And combining counseling, medication, and resources leads to the best outcomes. All right, so now I'm going to stop my share. I'm going to open up the floor now for any Q&A before I go into the next part of our today's discussion. All right, so I know there were some Q&A questions that I saw, I think, come up in the chat, but anyone could feel free to come off mute. You can share that. I'm going to look through the chat right now. I think there were some questions here.